Hello, everyone. My name is Yusof. I am a consultant rheumatologist from Leeds. I'm reporting for Room Now live in Barcelona to cover the EULAR 2025 Congress. In this Congress, there have been so many studies pertaining to CAR T cell therapies. The unique selling point of CAR T cell therapies is to achieve rapid and deep B cell depletion so that people will get long-term good response and also hopefully will be immunosuppression free. Uh, Apart from CAR T cell, there are also other ways that we can achieve this. So it's not just confined to CAR T. In fact, the old drugs that we have, which is rituximab, also can do this. So that's why it motivates us to look into our data in Leeds. So the abstract title number post 0325. So basically, we conducted a retrospective observational study of all rituximab treated patients with lupus in our center. So there were 148 patients altogether. In our centers, we usually only treat the patients based on clinical relapse rather than giving a fixed interval, for example, every 6 monthly or so, unless patient had a really severe disease, and to start with. So in our cohort of those 148 patients, only 114 were included, as quite a few of them were given on fixed retreatment. When we studied these groups, we can see like in the Kaplan-Meier survival, there were two distinct groups. One is what we call it super responder, and the timeline is actually 3 years and more. What we found that there were 20% of patients actually were super responders, and this is really highly interesting. And when we look into more detail, we found that actually 7% of patients as well were actually immunosuppression free, for which they stopped the treatments, after 12 months and above. And this is again really highly interesting. And we're trying to understand the characteristic of these patients. And these patients remain to have a low disease activity with SLEDAI score 2 or less, and also have sustained suppression of B cells, including the plasmablast. We look into the factors that associated to these super responders. In the multivariable analysis, what we found, there were three factors. So the factors included one, if they were of a non-European ancestry. So in our cohort, there were predominantly Black and also South Asians. Secondly, if the patient had concomitant antiphospholipid syndrome. And the third, if the patient who were given rituximab early, so early disease duration. So what the study tell us actually, if we give patient treatment with rituximab or the potentially other B-cell depleting therapies early in this worst prognosis group, which is the non-European ancestry and also the concomitant APS, they can actually got a better response and also longer lasting response. So this is really an interesting study, just to show that this can also be achieved with our older drugs. Certainly, we also now have better B-cell depleting drugs such as obinutuzumab. So hopefully, if once this drug manage to get approval, and if we can use it early, we may even see a better outcome and more super responders. So I hope that you found this abstract interesting. Follow us on YouTube, Twitter for more content coverage for EULAR 2025. Thank you for listening. Bye bye.